Welcome to Lancaster Human Performance Lab. Today we're going to look at the lactate threshold test. We've got Dr. Chris Gaffney on the bike and we've got Jack Cunningham taking the blood. So today's test will be 40 minutes in duration around. We're going to do 4-minute stages and we're going to take blood lactate every 4 minutes. We're also going to take the gas analysis so we can start to work out ventilatory thresholds as well as lactate thresholds. And so we are getting ready to start. So Chris, you're going to start at 25 watts. And ready, off you go. So on the screen now we see that we're collecting various data related to the gases that he's breathing in and breathing out, and his heart rate. So we've got his heart rate there at 91. We've got his oxygen in litres per minute. And that, because we're doing a lactate threshold test on the bike rather than running, we're not using the millilitres per kilogram per minute, we're using the litres per minute. We then have two important measurements that you'll need to use when you're going to work out the ventilatory thresholds. So we've got ventilatory equivalent for oxygen, which is the minute ventilation divided by the volume of oxygen consumed, and you've got the ventilatory equivalent for carbon dioxide there. And we'll probably ask you to plot those when you're looking at ventilatory thresholds in your second and third years. We also have the volume of carbon dioxide breathed out, his respiratory exchange ratio, and his breathing frequency. And here you can see in litres how much air he's ventilating per minute. So now in the last 30 seconds of the first 4-minute stage, Jack is going to take a fingertip sample of Jack's blood. Okay, and 4 minutes are up, so second stage, we are moving to 50 watts for this second stage from minutes 4 to 8. Once Jack has taken the capillary sample, he's taken it to the biosend to calculate the blood lactate. The first measure was 1.4 millimoles per litre. Now moving to the end of the second stage, and Jack will be taking blood again. The second stage was 2.43 millimoles per litre. We're moving into the last 30 seconds of stage 3, coming up to 12 minutes, so in the last 30 seconds Jack will take the blood sample. If your participant has stop bleeding, then you may not have to do another finger prick sample. We're coming up to the beginning of stage 4 now, and we move on to 100 watts. The lactate threshold test should take maybe about 9 stages to get a good lactate profile. So in this video, you'll see that we'll condense, rather than the 40-minute test showing every stage, we'll condense down the sections and move to the end of the test to start having a look at the lactate building up when intensity gets high. At the same time, we'll be able to use the ventilatory thresholds, VE-VO2 and VE-VCO2, so we plot them. We'll be able to equate the lactate threshold and the anaerobic threshold with the ventilatory threshold 1 and ventilatory threshold 2. So we'll utilise that data in your laboratories to calculate those values. Last 20 seconds of the test, the final lactate reading is being taken. The previous one was 6.92 millimoles per litre. So Chris is taking his last one. Jack's taking the last reading from Chris.
That's it.
That's it. Well done, Chris. Once the final reading for lactate is collected, we will plot the data on the whiteboard and do a simple lactate threshold graph. And make sure that Chris is warming down after his exertions. Okay, it's good that Chris is now in recovery. We're happy. Looking in the first 10 minutes of recovery, his heart rate's coming nicely down, just on its way down. Now up to 112 coming down. His RER is coming down 0.82, so we realise now that he's beginning to metabolise fat more than his carbohydrate. His breathing frequency is now nice, relaxed, between sort of 7 and 10, which is very much near resting breathing rate. And we're happy to say that he's recovered and he can finish the test. We'll now go and have a look at the results on the whiteboard. Okay, let's have a look at Chris's results. So he reached 7 stages of 28 minutes. Ideally, we would have wanted 9, but 7 should be able to give us a good enough curve. And we found out that his lactate was highest at 175 watts. We've got a rating of perceived exertion, so he was definitely pushing himself to the maximum at the end. So with lactate, we'd probably expect a resting one around about 1, sometimes between 1 and 2. Chris's was a little bit more elevated. That could be for a number of reasons. It could have been activity that he'd done earlier in the day. It could have been due to something that he might have eaten, but this is real life. This is a real life lactate threshold test. So we've got to note down what the data is, and we've got to try and fit the curve as best we can. So we've sort of plotted the data on here, and we've fit the lactate threshold curve as we were. And what we're interested in, we're interested in lactate threshold. So lactate threshold is this point where lactate starts to rise from above the baseline. And there we could probably work out that it's around about 80 watts. We're also interested in maybe anaerobic threshold. So we're looking at predominantly how long Chris could work at a threshold before he's getting into producing energy in the anaerobic form, where he can only work for maybe sort of 30 minutes at a time. And as an applied sports scientist, I'm really interested in this detail for if I was going to set training for him. Because if I'm going to set sort of threshold training, I might be setting threshold training around there. If I'm going to set long continuous training, I might be setting it down in this region. And if I was going to set high intensity interval work, I'd be setting it up here. So we can start to use this data to set training for it. We can also plot this again next time we test Chris to see if we can shift this curve to the right, so that he can work at a higher intensity and produce less lactate, and we can show that he's improved efficiency. Another thing that we would really want you to do is start to look at the lactate threshold and the anaerobic threshold and compare it to the ventilatory thresholds we talked about. So the ventilatory equivalent for oxygen and the ventilatory equivalent for carbon dioxide. And if we can plot those, we can start to compare lactate threshold to ventilatory threshold 1 and anaerobic threshold to ventilatory threshold 2. We've taken anaerobic threshold as 4 millimoles per litre, which is the term OBLA, or onset of blood lactate accumulation. There are other methods, a number of methods here. Another one is a Dmax, where you draw a line between the start and the end, and you take the furthest point from the curve. That might be another measure of anaerobic threshold. So when you're working with your athletes, you'll be looking at choosing which is the most appropriate threshold for them to be able to set them the right training intensities and then watch their improvement next time you retest them. So great effort by Chris, and I hope today's video helps you in learning about the lactate threshold test. Thank you.